Parkview Health says hospitals have changed for the better after surviving through the COVID-19 pandemic. WANE 15's Allie McKibben sat down with Parkview. She lays out how the pandemic has rewritten healthcare practices. Allie?
Yeah, it's been nearly 6 years since the COVID-19 had shut down the U.S. and overrun hospitals. And while the global pandemic has subsided, Parkview says healthcare has been reshaped to more effectively care for the patients of today and tomorrow. I spoke with Dr. Jeff Board, the Chief Quality and Safety Officer for Parkview Health System. He says one of the most significant improvements in healthcare was the ability to provide care for more patients at once and meeting them where they are. And we see that today in the rise of telehealth, but we may also see pandemic-aged methods of patient-centered healthcare return in the future. Board told me years ago Parkview expanded desperately needed ICU-level care in neighboring communities, and that made it possible for patients to travel shorter distances for healthcare and free up ICU space. And this adaptation to meet patients may make a comeback as threats to public health loom.
Historically, we've been protected from measles outbreaks because the rate of immunity due to universal vaccination has protected our population. However, the United States is faced with the high likelihood that we may lose what's called measles elimination status because we have had such a high volume of measles cases over the last 12 months across the U.S.
Beyond expanding care, Bohr says more meticulous data collection and a quickening pace in innovation are also positive side effects of the pandemic. And I'll explain how we may reap those benefits soon at 11. Allie McKibben, WANE 15 News.